Welcome back to The New Norm with Dr. Lou Graham, brought to you by Midway Dental and Catapult Education. The new news out of Washington today is big, and it's big news if you ask me, for all of us. And it deals with what they just passed in this huge legislation, and it deals with small business loans. So if you haven't been privy to the news, which we're pretty much all glued to, this is what I think will be happening. Overall, the release of business or finances will allow us to go to either the SBA site or our regional banks. And our regional banks will be able to loan us money. And the question is, how much money, and is it really a loan? And per my understanding, and from what I'm understanding as far as reading and interviews, this could be, if we bring back our employees, this will be almost a gift from the government for us to pay our employees, pay our payroll, cover some of our overhead, and really take that huge amount of stress off of our plate. That would be just enormous. I think we'll be hearing more in the next day or two. And openly, I want to reach out to our consultant, Nolan Yaldo, and ask him, and I'm hopefully going to bring him back onto this segment in the next day or two to ask him more about this. So stay tuned, because I think this could be a huge relief for dentists and all their teams, and how we can manage these tough 1 or 2 months of financial, we'll say, tough times. Okay, with that, I'd also like to do a big shout out to Steve Kizzy, president of Midway, and the management of Midway Dental. They have been donating masks along with PPE to regional hospitals, and we all know the urgent need, and I applaud you by doing this. I really do. It just makes me feel great that this is what we're all about. Given that, now I want to shift to our segment today. And our discussion is really going to get into safety. And safety as it deals with emergency patients. Truth be told, I think we're going to be seeing emergency patients probably for at least 4 to 8 weeks. We talked teledentistry yesterday. We're going to have a huge opportunity to learn more about that this week with a webinar with Miles, and more coming from Mark. But I think we have to talk about safety in our offices. And I'm going to introduce a Tracy Wales. Tracy Wales is a registered nurse, and she has been involved in training since 1995. So she's no rookie at this. And she is the president and CEO of Compliance Alliance. So this is how this all came about. A good friend of mine, a dear friend of mine, Dr. Tony Tamaro, who taught at LVI, ran many of their segments or their training programs, said, you gotta meet Tracy. I go, okay. I talked to Tracy last night, had a great conversation. She blew me away with knowledge. And again, I had no idea about a lot of these topics. And that's why we all come to this, because as dentists, we just don't know a lot of this stuff. So after talking to her, I said, let's make sure we connect. So I'm gonna introduce Tracy, and I'm going to go with the first question to Tracy. The first question is going to be, what are the current strategies for management of the patient care environment to prevent transmission of COVID-19 that we're discussing today? Tracy, let's talk about this management. It's all yours.
All right. Thanks, Lou. Thanks for having me here today. When it comes to the management of care, when you're providing care as you transition back into care, or if you're providing emergent care,
Yep.
A lot of what you're already doing is very, very effective against COVID-19. We're very fortunate in that COVID-19 is an enveloped virus. It's enveloped, so it's fairly easy to kill, and virtually any surface disinfectant kills COVID-19. Your solutions that you might otherwise use in your office, be it Optim or Cavi or BioSurf, any of these solutions are going to be effective if used correctly to eliminate any risk of transmission of the COVID-19. Now, You'll also get questions from your patients to say, how do I clean? Almost every Clorox household cleaner kills coronaviruses because they're fairly easy to kill. And if the claim on the label still says it will kill SARS-CoV-2, then it will kill, and if it will kill any coronavirus. That being said, it's important to remember that perhaps more frequent surface disinfection of surfaces that you are high touch areas that you're going to want to pay attention to. Now, you do that regularly in your operatories as you care for patients, but as patients are coming in and out, then you're going to want to pay more attention to things like pens, the door handle to your office, credit card machines, the kind of things that might have been overlooked up until now. But one of the biggest things that I stress, I said, solutions are awesome, but people prevent infections.
Right.
It's very, very important to remember that surface disinfectants, you have to clean your surface first, and that's usually the first step, which is either a spray or a wipe. That cleans it. The second step is actually your disinfection step. So you have to spray, wipe, and spray. You cannot spray, wipe, and walk, or spray, wipe, wipe if you're using the same Cavi solution, Cavi wipes, or wipe. And each one needs to be done, with personal protective equipment and stuff like that. But so long as everyone's doing a two-step process, spray, wipe, wipe, spray, wipe, and that includes things like impressions where you would spray, rinse, and spray, then everybody should be very effective in surface disinfection for any number of bugs, and particularly COVID-19.
Okay, wait. So let's talk about you went a little fast on that. So tell me the steps again, and is there a time response? Like, should people wait 10 minutes before putting the next patient in? Walk me through this, the spray, the whatever,
Sure.
and the whatever. Walk me slowly through, I'm clueless, so walk me through it.
That's fine, and I speak rapidly, and I should remember that.
Yes, you do.
So when you're doing, I'm going to slow down.
Okay.
So when you're doing surface disinfection, you want to be certain that it's always a two-step process.
Okay.
Because even a lot of the solutions that say it's a one-step process, that's in the absence of bioburden. So if it's a completely pristine counter, then you can use one step. So if I had a solution and I'm going to clean off a countertop, a chair, you're going to go ahead, let's say we're using a spray.
Right.
You're going to spray the solution on.
Yep.
And then wipe it off.
Right.
Now you're not supposed to put a bucket of 4x4s and then pour in your surface disinfectant, because the cotton in the 4x4s degrades the solution, makes it less effective, so on and so forth, okay?
Okay.
So fresh wipes, fresh solution, and then you're gonna spray it on, and if you spray it, then you wipe it off with your paper towel or whatever you're gonna use.
Yep.
That's your cleaning step.
Got it.
There's no time on that, and there's no time stipulated between the first step and the second step. So you can
Okay.
spray, wipe. Now you're ready to move to the second step, which is your actual disinfection piece. Now, every solution has claims against certain bugs, be it Hep B, Hep C, tuberculosis, and those are the benchmarks for what is considered to be a hospital-grade surface disinfectant. It must kill Hep B, Hep C, or TB.
Okay.
Now, for COVID-19, and each one will say, for example, if you look at Cavi, it's a 2-minute kill time for hepatitis B, and I believe it's a 3-minute for tuberculosis, but you're really not trying to kill tuberculosis in a dental office.
Right.
Other solutions, and your challenge is this: it has to stay visibly wet, no streaks, no marks, no fading areas. It has to be wet for that kill time.
Okay.
And usually for hepatitis B.
Okay.
And COVID may have a 30-second kill time, but there's solutions on the market that have shorter kill times. Like some of them, there's a hydrogen peroxide wipe from Clorox Professional
Yep.
that has a 30-second kill time. And
Okay.
that's awesome, because here, I'm in Las Vegas, it's extremely dry, and keeping a surface wet for a minute is almost impossible.
Oh, that's a really good point. So if it is dry, so what you're saying is you may want to go, otherwise you'd have to re-wipe it down to keep it moist. Is that right?
over and over and over again, and you're wasting resources. Wipes they're not free, nor is the person's time, and you need to be able to turn your chairs. So yeah, you want to use something. I don't recommend anybody really uses anything with a kill time more than a minute, because keeping it wet for that amount of time is impossible.
Okay, so one great pearl is 1 minute should be our goal on a kill time to leave a surface moist. Correct? That would be our goal. Okay.
Yes, absolutely.
So that's the initial first step. Now the second step is what? Explain that to me.
Okay, so your first step is your cleaning step. So you spray it, you wipe it, and you throw it away.
Okay.
The second step is the disinfection stage, where you wipe it down again or spray it. Let's say, okay, we'll do wipes first.
Yeah.
You wipe it once, you throw it away. You wipe it again, and you count for a minute.
A minute.
If it's a spray, you spray it, you wipe it, you spray it again, and it has to stay wet for the kill time stipulated by the manufacturer of the solution.
Okay.
For the bug you're trying to kill.
Okay. Great. Okay, I know I interrupted you. So that's our disinfection of surfaces. Keep going. Keep going. Yep. Because we were talking about preventing transmission. Yes.
Yeah, so again, your patients, and as you move towards bringing patients back in, of course, you're going to be screening them for risk. And if they are not, they haven't traveled, they haven't been in households, they're not running a temp, they don't have upper respiratory symptoms, then you're going to be able to see them in your office. Now, it's probably prudent, since you guys are dentistry, have your patients sit outside and wait in their car.
Totally.
And text them and say, okay, we're ready for you, so that you can maintain this social distance and protect everybody to the best of your ability. But remember again that these patients may be currently asymptomatic, but actually are harboring, the bug at this particular moment. Now, they say that patients with COVID-19 are the most infectious when they actually show significant symptoms. They're not shedding the virus tremendously prior to that time. So if your patients are asymptomatic, bring them in, sit them in their chair, but remember to work in your, you're not going to have patients sitting in your lobby. They're going to be waiting outside. But do remember your door handles that they will touch, because you guys regularly clean off light handles and everything in your operatories. But the things that get forgotten are things like credit card machines, door handles, pens, things up in the front office.
So let me ask you this.
And you may even want to consider. Go ahead.
No, you go ahead. Go ahead. And then I'll ask you the question. I don't want to cut off
I was saying you may. You're fine. The other thing to consider is when you may want to do credit card payments over the phone, when they're sitting out in their car or something like that, so that you have less face-to-face time with your front office staff. So there's a lot of different controls, engineering controls, administrative controls that you can do to decrease people's exposure long before ever going to PPE.
Right, I'm with you on that. In fact, in our office, when we're going to start seeing emergency patients, I'm not even going to have my front team there. We'll do all billing outside of the office.
Yeah.
My feeling is at this point, Tracy, it's the doctor and the assistant. Let's minimize everything over the next 4 to 8 weeks and do this right. And I think we concur on that. And openly, I think the waiting room will turn into the modern day living room, meaning it's not even used. I really look at it that way. I think it's...
What is that room?
Right, what is the living room? Well, I'll have to take the plastics off. Exactly. Grandma will
you
have
can't
to
go
move.
in that room, you little 3-year-old.
Right. I mean, the plastics were way ahead of COVID virus. That's all I'll say. Way ahead. Okay. So, welcome to my world. Okay. So, what are the strategies then to optimize PPE utilization during the shortage crisis? I mean, because I think this is an issue, because if we're going to see patients, and I know hospitals need them, but we also need them to safeguard ourselves. So let's talk about shortage and how we optimize. Walk me through your thoughts.
Well, and you brought up an excellent point where you have the assistant or the provider, the doc, going in and they're doing the screenings and stuff that your front office would do. That way your front office isn't wearing personal protective equipment. It's only the people that are going to use it. So you really need to be, I think that's smart. It's really smart to do that kind of thing. those things being said, when you start, you got to look at, your goal here is not to end in crisis. Your goal is to, save your personal protective equipment and use it more wisely, perhaps not conventionally, to know that you're going to have PPE for the long run. Of interest, CDC just put out a PPE burn rate, where you can actually calculate how many patients you see, how many masks you think you're going to use, how many are on the shelf, what are you going to get, and project your PPE availability in the not too distant future. And it's a fairly complex Excel spreadsheet, but if you're really looking at it, because the reality is this: general dentists right now, you're dealing with emergencies,
right.
But oral surgeons, maxillofacial guys, trauma happens. And they're going to have to continue to see patients. So in the hierarchy of some of these outpatient needs, they might be higher, and they might have more utilization,
right.
Than the average oral healthcare provider.
Right.
That being said, CDC came out because in cities, for example, New York, yesterday, New York had 10 times more in that little bitty state than the state of California had in the entire state.
Right.
Okay, so it's really
bad.
It's in a hurry,
yeah.
and there's a lot of it in New York.
I know.
Those things being said, right? So I lost my train of thought here. But when you're going to have to look at what is considered non-traditional use of personal protective equipment, and part of that is looking at reusing masks. Now, there's a difference between reuse of a mask and extended use of a mask. When the guidelines, because CDC actually put out a document dealing with different use, if you will, to prioritize and extend the use of certain personal protective equipment.
Right.
In the case, and originally they came out and they said N95 masks. N95 is what you can use. But then they realized that a lot of people may not have access to N95 respirators, and nor would they have the infrastructure to be able to use them. And we'll talk about that in a bit,
yeah.
I suppose. But so now they're saying you can re-wear regular surgical masks, ear loop mask, tie masks, and there's two different ways to do that. It's either considered extended use. You would put on your mask, put on your eye protection, and then you would wear it for the foreseeable future, okay? As in during the day. Don't touch it, don't touch your goggles, don't adjust, don't touch your mask, don't do anything. And the likelihood that you will transmit disease from your head is very, very low. So they say, put your mask on, put your goggles on, and call it good. Don't touch them. Of course, you'll take them off to eat. At the end of the day, if they get contaminated,
wow.
Splashes,
okay.
blood, whatever the case may be. Yeah. And if they get wet. And they're going to get wet one of two ways, either through the aerosol that's generated in dental operatories or through just respiration, because it's a wet process. So, but you may go through 4 masks in a day per person rather than the dozen you might otherwise have used. And then the other piece is reuse of a mask, but reuse of a mask involves taking it on and off between patients, and people auto-inoculate with stuff, if you will, when they're taking, how many people do you see take off their goggles with dirty gloves?
Oh, I know.
And
it's
so
disgusting. I know, we all do it. Yeah, you're right.
Yeah. Yep. And then they put that mask underneath their chin
I know.
and then snuggle with their kids or their grandkids
Yeah.
later. So,
I know.
Yeah, so all those things taken into account, I'm not a big proponent of reuse of masks.
Right.
If you're looking at, significant, we're starting to run out type things versus crisis, we have none, that you're going to want to look at probably wearing your masks for an extended period of time. And yesterday, they actually came out with something for gloves, talking about washing gloves. If you have none, if you're down to 1 box of gloves and that's all you're going to get for the next 3 weeks, but I believe we'll transition into that. The gloves are fairly plentiful right now, and the masks are very, very difficult to get. So know that potentially is in your future and kind of go from there.
So let me ask you, are you against facial shields in this mode? Wearing shields to protect the mask? That's what we've all been using over the last...
I think it's smart.
Okay.
I think it's very smart. In fact, they even came out with a provision this morning, I think it was, related to if you have no masks, you have nothing. If you wear extended face shields, you can use those in lieu of a mask if you're taking care of asymptomatic patients. And that's the key in a lot of this, is taking care of asymptomatic patients, because the reality is in outpatient dentistry, you shouldn't be treating anybody who has an airborne disease that is known or even suspect, you know. Because you just can't protect yourself.
So let me ask you just another question, because there's so much so much going on out there. Do you feel obviously that if someone comes in, they're low risk and they're obviously coming in their clothes, because we're not working on naked patients, do you feel that we should cover their clothes? I mean, should we be putting a gown on them, or is it just whatever we're going to do, we're going to decontaminate the chair and we don't have to worry about their clothes, their shoes?
Right. Just
a question to you. What do you think about that?
No, absolutely. Studies have shown when they look at how bugs grow on surfaces, bugs that are growing on what would be considered a fomite, be it fabric or cardboard or something like that, the bugs do live there for extended periods of time.
Right.
But they have not shown any transmission from vectoring from an inanimate surface to a person. Now, honestly, how they would establish that is tough. I don't know how they did it, but that's what they're saying.
Okay.
But I think that if you are doing good hand hygiene when you're done, because you have 10 fingers and 5 holes. If I was a bug, this is where I'd hitchhike to get in, is the truth of the matter. And so your goal is and I've touched my glasses 700 times because they're new, and I scratched my nose twice. Keep your hands away from your face. That's your biggest challenge. Good hand hygiene and keep your hands away.
So what we've been doing is we obviously do when the patient walks in. Again, if I'm wrong, please tell me. I have no problem in front of thousands of people. I'm a big boy on that. Let me ask you this. So we have the patients walk in, and we don't let them touch anything. We do a thorough happy birthday to you hand washing of the patient. And then we're also doing a mouth rinse. I know a 1% peroxide equals solution. We've been using a product called Aura Rinse and iodine. We use AuraCare, really cool. I do believe we should be at least doing a mouth rinse pre and post and hand washing at a minimum, just to minimize cross-contamination. Am I overdoing it, or you think we're okay there?
You know, any people are capable of vectoring bugs at any given point in time. I had honestly never thought about having patients wash their hands, but I don't think it's an unreasonable. But remember that then you have to worry about, do you have hand-controlled water? Do you have hand-controlled soap? Those kinds of things. And if that's the case, then those are going to need to be cleaned more frequently. And again, with your mouth rinse, in looking at aerosol, it's probably not a bad idea either. Anything you could do to limit the spread of this stuff and contain it is probably a good idea. But remember that when we talk about aerosol generating procedures, when it's used as that term, it's stuff that comes from your lungs. I make you cough like crazy, or we intubate you, or do a bronchoscopy, not necessarily aerosol that is generated from a piece of equipment.
I know.
If that makes sense.
I do.
So
I hear you, but as a dentist for 35 years, I can't tell you how many thousands of people have coughed in my face with a mask on, and now if they're coughing COVID, it's not what I want. So that's why I think, let me do a pre-wash.
Me either.
Okay, that's all I'm saying. Okay, I'm going to move on to the next subject.
I don't think it's foolish. Okay, go.
Okay, so everybody's out there thinking, level 3 is our traditional mask or whatever we normally use. And everybody's thinking an N95. I'm just going to order these KN95s, which I guess are non-3M or N95s. You and I have talked about this, and this blew me away. So we're going to do a little demo with you demoing really what's involved in an N95 mask. Because I thought, like everybody in the airport, they're just putting these things on and we're good to go. And you told me basically, Lou, that you are not good to go. Why don't you take everybody through our audience and really educate them on N95 masks? Do it.
Okay. Go. Yeah, I was at Home Depot the other day and about fell out of my tree. So, When you're working N95 respirators and masks, you can't just put on an N95 respirator the same way you'd put on a pair of gloves and go, hey, these fit, I'm using them, I like them. N95 respirators are not that way. And it's important to remember that surgical masks, your level 1s, 2s, or 3s that you're using, are more designed to protect you and my surgical field from me than they are to protect me from you. Okay?
Yep.
Now, when you look at an N95 mask, N95 masks are designed to protect me from you, and so long as they don't have a valve on the front, they serve the purpose of protecting my patient from me or my surgical field or whatever it is. So this guy right here, they're in no way the same. But looks like a mask, it's got ties, this, that, and the other. But in order to be able to have anybody wear an N95 respirator, they need to actually, first, they have, because these, if you've ever worn these, it's kind of like trying to breathe through a plastic bag. They filter 95% of all particulate. And the goal of an N95 is never to breathe around the outside, because your surgical masks, you breathe through these parts and all of this. But these guys, they form fit to your face so that I'm breathing through the mask and not around the mask. Now, when I put this, so you have to have a physical. An employee has to have a physical. It's a standard form. I think there's 29, 30 some questions on it. I believe the first 9 are mandatory. So you have to have somebody do a physical to determine that that person has the pulmonary capacity and that sort of stuff to wear an N95 respirator.
Okay, wait.
Once they have a physical.
Wait, so let me ask you.
I'm waiting.
Can you do the physical, like, could I do the physical for my assistant and vice versa? I mean, do I need a physician to do this?
You know, the questions are very simple.
Okay.
You know, have you been a smoker? You've been at COPD, but here's your issue, because from an ADA perspective, you really don't necessarily, you don't want to know. You know, these are not questions that you may or may not want to know the answers, because then you have ADA issues at work with your employees and employment. So remember, there's online services. You know, you could put your people through and they ask these questions and they do telemed and get their physical done. And I don't even know how much they cost, but I do know a lot of people use that service.
Okay.
So once they have their physicals done, then you have to actually do respirator fit testing. Okay. So if I was going to do respirator fit testing on me right now, well, first you have to fit them for the mask, and not every mask fits everybody's head. When you look at, they may have a skinnier nose or a fatter nose or a skinnier face or a more round face. Whatever the case may be, different masks fit people differently. This right here is a 3M mask, and N95 is N95. N95 stands for NIOSH, which is the National Institute for Occupational Safety and Health.
Of course.
And they're kind of a go-between between OSHA and CDC. Right? They set the standards. Manufacturers get their product over the bar. This filter's 95%. There's 99s. There's 100s. So there's lots of these on the market. So you'll have a selection of respirators from which they can choose. They have to have certain training on how they're going to wear them, the purpose, the whole don't breathe around the mask, but rather breathe through it. So you have to have that training. And then you take them in and you take a good look at their face and go, that one, and put it on. And then they're going to take that respirator and they have to put it on their face and attach the straps. And then they crunch it to their nose using both hands. I know. You don't just put these on. And you can't scrunch this way. You have to scrunch this way so that you have equal pressure between your hands. Right? So you put it on, and normally you put this one on the top, and this one would normally go on the bottom back here, but it actually gets tethered to the top of your head most often to cinch it up under your neck, under your chin, right? So, okay, you found a respirator that and then once you've got it on, then you put your hands over your mask and you breathe out, and you should feel pressure build in your mask, and then it goes poof. Or you suck in, take a quick breath in, and normally the mask does a little bit of this. These are stiffer compared to duckbill type masks that are composed of stuff similar to your surgical masks.
Right.
And so once you determine that you're breathing through it, then you have to sit there and wear it for 5 minutes. Okay? So, and you wear it for 5 minutes before the testing begins. So this right here, this lovely device.
Yeah, you look good. You look good.
I am bringing sexy back.
Okay.
That's what I know.
You go,
So
baby. Yep.
this is the testing hood. So if you are an employer and you want to have N95 masks, you have to put your people in here. You have to have the kit, right? There's sensitivity solution. That's one's sweet, one's bitter, and you have to have both. So you're going to take, when they don't have their mask on, let's say this was the sweet, and then I would use my handy dandy sensitivity solution. And there's a sweet one and a bitter one because some people can't taste one or the other. And honestly, you don't find it out until you're doing this. So you put this in here and then you put it inside and blow in 10 puffs. And they're supposed to have their mouth open and their tongue out. And then you spray it in. And usually they can taste it within 3 to 5 breaths. Okay?
Yeah.
And once you determine that they can actually taste it, then they take their hood off, put their mask on, and wear it for 5 minutes. So then, now they're in here, and so they've got their mask on, then they put on their handy dandy hood, and it's easier if you pull it, it's nicer if you pull it away from their face because it can be a little claustrophobic. Okay, so you pull it forward, and then you're going to use your handy dandy test solution. And when you use the test solution, you have a separate one of these. I'm telling you, I feel like I should be on the moon. Use a separate one, and then the employee is going to do a series of 6 exercises for 1 minute each in order, and then they're going to talk. They're going to turn their head from side to side. They're going to turn their head up and down. They're going to bend at the waist. Now, hold on to this when they bend at the waist, because if it falls off, you have to start all over again. So it's actually a fairly involved process. And if at any point when they're turning their head and doing their thing and speaking, they read something or they can sing, perhaps recite a limerick, would be amusing to me. And so they do this thing, and if they can taste it at any given point in time, that respirator is not a good respirator for them because at that point they are breathing somewhere around their mask and not through it. So it's not just pick up a mask and start wearing it like the guy at Home Depot behind the cash register the other day who had giant holes up here and all this stuff. I'm like, man, if you're going to wear this. So that's kind of the lowdown.
So wait a second. All these people on planes, they're just wearing these things and they have no freaking clue. Really? I mean, they don't know. I'm sure nobody's going through this kind of testing. Okay. This is amazing to me. So let me ask you, because every dentist is going to care.
It makes me giggle.
Yeah. I mean, I was going to call you from Houston and say Apollo 1 come in, but I'll leave it alone.
I know.
How much does this whole thing cost then to set up and do this right? I'm a dentist. So tell me how much this costs.
I know. Understood.
Yep.
You know, you used to be able to buy this particular kit for about $250, $275.
Okay.
But of course now everyone, and you can buy them through McKesson. I don't know if you can buy them actually through the dental side of Henry Schein, maybe through the medical. And I don't know if the dental supply houses, if they all carry them, but I doubt it. You can buy them on Amazon. There's direct from 3M. And I believe last time I looked, they were about $400 or $500, of course, because everyone wants them and it's supply and demand. But yeah, you're looking at, and then you have to do this. Anybody you want to wear a respirator, they're going to do this testing at the point of hire, and then they're going to do this testing annually as well.
Right. So,
and if they have any changes to they can't have facial hair. I mean, it's fairly complicated. Except goatees.
So let me ask you this. I'm stuck on this whole thing with the mask thing. So if a doctor orders this and they have to go through the questionnaire and all this other stuff, I mean, I'm not promoting your company, but I'm going to ask you, is this what your company does? Tell me walk me through this, because this is all new to me. I've never seen this before, and it's kind of overwhelming.
Fair enough.
Yeah, okay. I'll shut up now. Go ahead.
Fair enough. That's okay. When people talk to me, what do you do? I tell them that we are to OSHA and infection prevention what a CPA is to taxes. We write your programs, give you the forms and systems and posters and stuff, do all your training, train all your new employees, that sort of stuff to get you to where you need to be. Because as you can see, this is not it's not simple stuff. And it is to us because it's what we do every day. You know, I always tell people, if I billed for you, you'd never, ever get paid. But when we do this, and we do this remarkably well, all of my safety engineers have degree in safety science or public health and that kind of stuff. So yeah, we come in. And with that whole CPA piece, I have a CPA for a reason. I don't know that I would give my taxes to anybody in this office to do, because there's so much liability in it. And believe me, when it comes to infection prevention and OSHA, there's huge liability.
Right.
You know, and I guess people are realizing it now. So yeah, this is what we do.
Okay,
and have for 25 years.
Okay, so you're on the West Coast, and a lot of us happen to live a little further east. So, I mean, do you guys get on planes and just do this with offices? Again, I'm just asking. Go ahead.
Yeah, no, that's fine. Depends on what clients want. Yes, yes, we can. We also have some remote training options. We have a lot of different programs and price points and stuff like that, but everything we do is custom tailored to your office, because what a orthodontist does is distinctly different from a perio or an oral surgeon or anything like that. So it's all tailored to your office. No one's filling in a book and gets to page 72 and forgets about it, and it's just that way forever.
So let me ask you this, and then we'll close, and because I'm going to ask you to do a webinar for us, because everybody's going to want more after listening to you. Okay. So I'm in Chicago, I need the hood, I need the mask because I don't want to get sick. And I mean, this virus is affecting 40 and 50-year-olds, not just people my age. I got a team, I got to protect my associates. Exactly. Okay. So, I mean, if we buy all this stuff, as a company, could we ask you or hire you to walk us through remotely how to do all this and make sure that we're all safe?
Absolutely.
Okay, that's my bottom line, because I think
train the trainer type stuff. Absolutely.
Exactly. Okay, because for us, I can only tell you, I don't want anybody to get sick from me, but I equally want to be so protective of my team. And if you can help us do what you just showed us,
of course.
There are a lot of people nodding their heads out there and go, we need this. In fact, everybody needs this. So we're going to schedule you for a webinar ASAP. We're going to get more into the details.
All right.
And can I just say thank you so much? This has been unbelievable. I really mean that. And I've known you 24 hours. This is unbelievable. Thank you.
Most people's opinion changes after time. It's okay.
I've heard that.
No,
before
you know what?
Too.
I really appreciate it.
Thank you.
I see you knew Tony. But yeah, no, I really appreciate the opportunity. Thank you.
Okay. Thank you so much. You have a great day. Bye-bye. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.